Hello, I'm Steve Roberts, journalist, commentator, and the Shapiro Professor of Media and Public Affairs at the George Washington University. Welcome to our conversation, the science and practice of addressing college drinking. Harmful and underage drinking remain significant problems at colleges and universities across the country, with serious consequences for both the students and their schools. And all too often, these problems can seem intractable, leading to frustration and questions about how we can reduce student drinking and its negative consequences. Today, I'll be speaking with two distinguished panelists, a research scientist and a college president, who approach this critical issue from different but complementary perspectives. Dr. George F. Koob is the director of the National Institute on Alcohol Abuse and Alcoholism at NIH. He's an internationally recognized expert in the neurobiology of alcohol and drug addiction. Dr. Jonathan Gibralter is president of Wells College in Aurora, New York. He's an accomplished scholar and nationally recognized thought leader on efforts to curb binge drinking and promote responsible behavior on college campuses. Let's get to the questions. Dr. Koob, the first one for you. Recent statistics indicate that almost 40% of college kids engage in binge drinking every month, and researchers estimate that alcohol is involved, there's some astounding numbers here, in more than 690,000 assaults, 97,000 sexual assaults, and 1,800 deaths among college students every year. And even those students who don't drink may experience secondhand effects, interrupted sleep and study, or being the victim of an alcohol-related assault. So, Dr. Koob, is the problem getting worse?
Well, the simple answer is yes. And the metrics that we use to assess that are twofold. One is that a number of recent surveys have shown that the intensity of binge drinking is increasing. And so instead of just doing a few drinks in an evening, young people are doing 10, even 15 drinks in one evening, which is far beyond the level that we consider a binge, which is 4 drinks and a few meals.
And a far more serious threat to their health.
And a far more serious threat to their brain. And the second piece is that we pick up is that there's been a significant increase in hospitalizations associated with this age group related to alcohol in the last 10 years. It's a steady increase over the past 10 years, reflecting this steady increase in the intensity of binge drinking.
Do you have a sense from all the studies you've done of what's behind these trends? Why is that particular dimension of this high intensity phenomenon getting worse?
Well, part of it is cultural. I think there's a tendency for young people to believe that they're invincible and that alcohol really...
But young people have always believed that.
Yes, of course. And that the alcohol, they don't really understand the dose effect function for alcohol. And the dose effect function for alcohol suggests that past a certain level, you are basically incapacitated, both emotionally and physically. Dr. Gibralter may want to comment on this from the perspective of a college president, but I think part of it is a cultural phenomenon that binge drinking is an acceptable form of drinking, and young people are drinking to get as intoxicated as possible in as short time as possible. And we're not exactly sure how that came about, but it has extended beyond college age drinking to middle age drinking. It's a phenomenon across our society.
Now, Dr. Gibralter, as Dr. Koob says, you are on the front lines here. This is the third college you've been a president of. You spent many years dealing with kids this age. What's your take on from the perspective of a campus, of what explains the trends Dr. Koob's talking about?
It's something that it just has perplexed me for years, Steve. I go to sleep at night worried that I'm going to get a phone call and that something's going to go terribly wrong in the night. The question that you asked is one that I also it's been perplexing me for years. Why college students have always consumed alcohol. Why now is it so much worse? Why are they consuming so much more alcohol? I was talking to a student last year, and I was asking him to explain his behavior, and he said, my goal is to get blackout drunk. I said, explain that. Why would that be a goal, that you would black out? And he said, because it's just how I have a good time.
What about within that, you see the rhythms of a school year. One of the studies I know has emphasized that the early weeks and months of a semester, when students, perhaps their anxiety level is higher, they're adjusting to either a new campus, new roommates, new courses, that's connected, that this is a particular danger point.
Early on in September, when students first arrive on campus, especially freshmen, is certainly a high-risk time for college students. For those campuses that may have homecomings, also a high-risk time. Halloween, there are certain times during the year where you're more likely to see the incidence of alcohol consumption go up.
And why? I mean, connect the dots for us. If there are certain times a year, it is perplexing, but you're deducing any pattern here? Are you deducing any danger signal that this pattern reveals, Dr. Koob?
Well, I think it really boils down to a very basic phenomenon of why people drink. And people drink to celebrate, but they also drink under conditions of stress, under conditions of loneliness, under conditions of boredom. And I think that for young people, it's difficult to understand, but when they're displaced for the first time into a new environment, some adapt very quickly, some do not. And there are social stressors that come in, there are loneliness stressors, there's workload stressors, there's all kinds of stressors that kick in, and that can start to turn things in the wrong direction. It's when people start drinking to alleviate those stressors, you really have a problem.
Right. And I would guess also one factor, particularly when you talk about freshmen coming to campus for the first time, it's the absence of parental controls and supervision must be a key variable too.
It certainly is, and one of the things that I've always done is I try to engage parents early on because we need them to, I say to parents all the time, they don't understand how many young people are dying every year from consuming too much alcohol when they first go away to college. And I really need them to be our allies. I need them to talk to their son or daughter. The most frequently expressed thing I hear from parents when we have contact with them is, that doesn't sound like my son or daughter. They don't drink that much.
But they do.
But they do.
Now, let's talk about this, because one of the things we want to do is help parents be part of the solution, not the problem here. So if someone is sending a child, particularly a freshman, off to college, should there be a talk before she gets to campus? What are some of the elements you've learned that, because you've studied this so carefully, that can make a difference, Dr. Koob?
Well, yes. I mean, I think one of the key places that a parent can help their student is to remain in contact, to keep the lines of communication open. That's one of the basic tenets that I think Dr. Gibraltar would agree.
Communication is a big word. What are some of and obviously this can have an effect in keeping kids on keel, right? And that there's someone watching them, that this loneliness, this sense of anxiety, they have a support system. But beyond that, what role can parents play? What role can roommates play? I mean, presumably some of this is an early warning system to try to catch kids before they're in real trouble.
It's, first of all, colleges and universities need to educate young people because a lot of them come to college and they don't understand, the whole issue of how much they consume and what it could do to them. They're inexperienced. So when you don't know what you're doing, you frequently, and remember also that the consumption of alcohol for up until 21 is illegal. So they could not only get themselves in trouble physically, they could get themselves in trouble in other ways as well that could end up really putting a damper on their entire career.
Sure. I've had students, get arrested in downtown Washington with open container laws and underage drinking. Absolutely.
And I always encourage parents to please stay, as Dr. Koob said, stay in contact with your student. Talk to them, ask them how they're doing. Leave the door open and let them know that if they're not doing okay, that you can have a conversation with them.